So let's start. Let's begin the class. Okay, so I will start from the beginning again. All right. Okay. So edema. We will be discussing about edema. So what does edema means? Edema means there is excessive swelling. Understand? Means there is excessive swelling and the fluid is trapped in the body tissues. In the body tissues, the fluid will be trapped inside it. Understand? And it will affect mostly in which part? In all the extremities. Mostly in all the extremities it occurs. Extremities like what? In your hands, all right, in your arms, in your hands, arms, in the feet, okay, ankle, legs, all this portion, edema usually occurs. So you will also see some sign and symptoms in edema. So what are the sign and symptoms that you will find in edema people or edema patient? You will find that there is swelling, or else there is puff. I mean, puff means swelling. Okay, puff is the another word for swelling. You will find that there is puffing. There is puffing of the tissues in your skin. All right, and the next one is means since there is excessive fluid in the body tissues, excessive fluid in the body tissue, you will find that uh, it will become stretched. All right. Obviously, there is excessive fluid in excessive fluid in the body. So obviously, because of that, what will happen? It will stretch. Even in the balloon, also you can see, right? If you insert some air inside the balloon, you will find that the balloon it will get stretched. It's not it. So same thing. Even in your leg, also, even in your body, also, you'll find since there is excessive like fluid inside the body, you will find that they will be stretched, and you will find that it will stretch and it will become shiny. Okay, this is shiny. It's shiny. It's not it, and it will become shiny. Okay. The next one is uh, if you like if you what is if you give a pressure, if you give some pressure in that affected area, that is in the edema, you will find that the skin, the affected area, it will go down. It's like a pit, P-I-T, pit. Okay, pit means down, means hole, you can say. Okay, just like a dimple, a dimple. So just like that, it will go inside it, and it will remain in that position for few seconds, for several seconds. Is it clear? Is it clear?
Yes, ma'am.
Okay. Okay. Next is sign and symptoms. So so same thing. Only the first one. Just now I shown you sign and symptoms. So there are some more sign and symptoms. Okay. If there is edema, what will happen? uh, the person can have nephrotic syndrome also. So these are some nephrotic syndrome that you will find. Okay, nephrotic sign and symptom that you will find. First is foamy urine. Foamy means what? It will become just like a bubble. Means the urine also it will become just like a bubble. Okay. Next is the person might gain weight also. Next is fatigue, weakness. Fatigue means weak. Next is anorexia. Anorexia means loss of appetite. Means the person won't feel like having anything, eating anything, since there is loss of appetite, or else anorexia. Okay, this is anorexia. Okay, next is feeling very tired. If a person does something very minute things also, na, very little, it's very little thing, very simple thing. So the person will get tired very soon. Is it clear this portion? At least in the chat box, if you want to talk also, at least in the chat box you say yes, no, like that, so that I can know. No?
Ma'am.
Okay. So, common causes of foot and ankle swelling means what can be the cause of this edema? What is the reason? What is the reason behind this edema? Okay, first is trauma. Trauma means accident. All right, trauma means accident. So, if a person is having or facing some trauma or some accident, so what will happen? Obviously, there will be bleeding inside the body. It's not in the internal organs. So, uh, since there will be obviously there will be inflammation, right? So because of that, the person can have edema. All right, first is trauma or else accident. Next is arthritis. The second one, arthritis. Arthritis means inflammation in the joint. In the joint, no, means in your bones there is a joint, right? So in that area or in that portion, you will find that there is inflammation. So because of arthritis also, the person can have edema. Okay, next is varicose vein. Means since there is damage or what to say weak veins, no, or else weak valve. That's why the means varicose vein will occur. Okay, and because of the varicose vein also, what will happen? Edema can also occur. Okay, next is deep vein thrombosis, DVT. Because of deep vein thrombosis also, since there is blood clot inside the vein, so what will happen? Their edema can also arise. Understand? Next is infection. So infection, it comes up in the part of trauma. Like if a person is facing some accident, so what will happen? So, there will be uh, that portion, that affected area will be infected. All right. So at that time also the person can have edema. Understand? Next is pregnancy. During pregnancy also the person can have edema since in pregnancy time you will find that there is excessive this one fluid. So that's why it will go to the ankle, means in the leg, in the extremities, hands, in all those portions also you can find that there will be edema. Next is a certain conditions such as heart, liver. We will discuss in the next slide about this. So the person can have edema because of all this also. Okay, next is some drugs, that is NSAIDs, non-steroid anti-inflammatory drugs. So in all this medicine also, we will discuss in the next slide about all this. So these are some reason, these are some cause for edema. Okay, this one also same thing. This one arthritis, inflammation in the joint. Okay. So some medical condition we will discuss now. That is in the heart and in the liver. Okay. So first is liver. In liver, what type of abnormalities can occur? In liver, which is known as cirrhosis. Okay, Cirrhosis. Cirrhosis of liver. This is the healthy liver. This is the unhealthy one, which is known as cirrhosis. All right. Okay. So, in cirrhosis of liver, what will you find? There will be fatty liver. It is also known as fatty liver. Okay, because of that, what will happen is if a person is having cirrhosis of liver, you will find that there is abdominal. This is the abdominal cavity. All right, this is the abdominal cavity. You will find that there is excessive fluid, which is also known as ascites. All right. In the ascites, what will you find? You will find that there will be excessive fluid in the abdominal cavity also, as well as in your legs also, excessive fluid. Is it clear?
No, ma'am.
No. Okay, so this is the healthy liver. This is the cirrhosis of liver. Cirrhosis. Okay, means fatty liver. You can say that this is the cirrhosis of liver. So in edema, what will you find? Means means not exactly in edema, means since there is since this one is unhealthy liver, right? Fatty liver. So this fatty liver or a cirrhosis of liver, it can lead to edema. It can cause edema. Alright, if a person's liver is unhealthy or else if the person is having cirrhosis of liver, so the person can have edema in the legs as well as in the abdomen also. Abdomen, there will be excessive fluid in the abdomen, which is known as ascites. Understand? Not only in that portion, it will affect the legs also. That is, yeah, it will affect the legs also. Like there will be excessive fluid, right? So that's why. Because of the unhealthy liver or a cirrhosis of liver, the person can have edema. Is it clear now? Yes or no?
Yes, ma'am.
Okay. Okay, next is kidney disease. If a person is having any kind of kidney disease, the person will be at the risk of having edema. So in this kidney disease, what usually happens, since there is extra fluid, since there is extra fluid and sodium chloride, NaCl, since there is extra fluid and sodium chloride in the body, in the body, what will happen? It might cause edema in the eyes also. It might cause edema not only in the legs, it can cause in the eyes also. Okay, which is known as nephrotic syndrome. Okay, nephrotic syndrome. This one, because of some abnormalities in the kidney, which is known as nephrotic syndrome, where there is excessive fluid and where there is excessive sodium, what will happen? It will lead or it will cause to edema. Not only in the legs, it will cause in the eyes also. This you can see it, right? Means in this area, it will puff up, it will swell. Is it clear? Is it clear? Some medical conditions like liver, kidney. Is it clear? Yes or no?
Yes, ma'am.
Okay. Okay. So it will means because of liver, kidney as well as heart. You know the heart, HEART. This one. Because of heart also it can occur. All right. That one. That PE, na, pulmonary embolism. What will happen in the heart means in the lower portion, you have got four chambers of the heart, right? So the four chambers of the heart, there is a down portion that is known as the ventricular portion. The ventricular portion, what will happen? There will be some abnormalities. The blood won't be able to circulate because of some abnormalities. What will happen? Because of that, uh, it will accumulate. It will go and get accumulate in the extremities. It is in the left portion. All right. So because of that, also edema occurs. All right. Okay. And some medications and some medications also can be the cause of edema. Means some side effects will be there, and ultimately as a result it can cause to edema also. Okay, so first medication let us discuss, or else first drugs let us discuss. So the first drug is high blood pressure medication. So in the high blood pressure medication, what happens as the dose gets higher of that medicine, as the dose of that medicine gets higher, what will happen? The person will be at the risk of having edema because there will be swelling. Okay, in both sides of the leg, there will be swelling. So that's why the person should not have this kind of medication. It is high blood pressure medication. All right. like for example lisinopril, enalapril, all these are the type of medication that the person should not have. Okay, is it clear? High blood pressure medication. Next is NSAIDs or else non-steroidal anti-inflammatory drugs. NSAIDs. Okay, if a person have this NSAIDs or else non-steroid anti-inflammatory drugs, what will happen? There will be increase in sodium level. Understand? There will be increase in sodium level. So that's why it will means if the sodium increase, if the sodium level will be increased more, so what will happen? There will be more chances of like edema, right? Because in edema means obviously there is increase of sodium, and it will have more sodium, and obviously it will be like dangerous for the patient. It's not it. So that's why the person should avoid this kind of drug, that is non-steroid anti-inflammatory drug. And non-steroid anti-inflammatory drugs, what is the use of this? It is used for treating pain, such as diclofenac and all this. No, means it is used for treating the pain. So during edema, like the person should not have this kind of drugs. Next is steroid drugs. Steroid drugs, what is the use? For gaining muscle strength. Alright, but in edema, why a person should not have? Because if a person will have this kind of drugs, there will be some abnormalities, or else there will be some irregularities in potassium, calcium, phosphate levels. Understand? And ultimately, it will lead to edema. It will lead to high blood pressure. It will lead to heart irregularity, and as a result, it will lead to edema. So the person should not have like this kind of drugs, such as steroid drugs. Okay, is it clear? Steroid drugs, because there will be some abnormalities uh, in potassium, calcium level, na? There will be increase in high BP. There will be some abnormalities in the heartbeat and all that. So that's why the person should not have these steroid drugs. Okay, is it clear? Okay, next is estrogen. Okay, so in estrogen medication, what will happen if a person will have estrogen level? Obviously, estrogen medication, so obviously estrogen level will be high, and you will find that there will be decrease in progesterone in estrogen level. Now, if you have this, there will be decrease in progesterone level, and ultimately there will be water retention. Means the water uh, it will gain more. The water will be more. Understand? The amount of water will increase. If a person will have this estrogen, the amount of water will increase. So ultimately, if the amount of water will increase, so ultimately, what will you find? You will find that there will be chance, or it will lead to edema. So that's why the person should not have this estrogen. Okay, is it clear? Estrogen. Why the person should not have estrogen? Because if a person will have estrogen, there will be uh, the person will gain more amount of water, and it will lead to edema. So that's why the person should not have this estrogen. Okay, is it clear?
Yes, ma'am.
Okay, next is certain diabetic medication. Right, certain diabetic medication, which is known as isoni- isonidione. Okay, so like this kind of drug the person should not have. Why? Because if the person have like this kind of medication or have like this kind of drugs, they will increase the fat mass. Understand? And also there will be increase in fluid retention also. Means same thing here also, the fluid will increase more, and ultimately it will lead to weight gain, obesity. All right, and ultimately it will be dangerous for the patient again. So the person should not have like this kind of drugs. Okay, next, the last one is calcium channel blockers, also known as CCBS. Okay, this kind of medication, like certain diabetic medication. So this kind of drug, what is the use? The use is that they used to, they will help in blood glucose level. All right, I'm just telling you the uses. Okay, next is calcium channel blockers. So calcium channel blocker, what does it usually do? They usually decrease the blood pressure. They usually decrease the blood pressure. Okay. Okay, if the person is having CCBS, calcium channel blockers, what will they do? They will be increase in capillary, this one. There will be increase in blood capillaries. And obviously, if there is increase in blood capillaries, they will lead to what? They will lead to leakage of fluid. Means the fluid level, no, it will leak. If it will leak, what will happen? Obviously, there will be extra amount of fluid again. It's not it. So that's why the person should not have this kind of drug. That is calcium channel blockers. CCBS. Okay, is it clear? Is it clear about the cause of edema? Yes.
Yes, ma'am.
Okay. Okay. Next is complication. You will find some complication also in the person. So what kind of complication you will find? You will find that there is pain, pain in the affected part, and the person will find difficulty in walking, and the muscle will become stiff. It's not like since there is like lots of fluid inside the affected area, the person will the person like, body will become stiff now. It will become hard now. It will be difficult for the person to move. So it's very heavy. The you just imagine like something is there inside your body like fluid. Obviously, it will be difficult for you to lift up also. It's not because it's heavy. So that's why the muscle will be stiff and the person will find difficulty in walking also. Understand? And ultimately, it might be to skin ulcers also. Listen, there is inflammation. There will be inflammation also. That's why it will lead to skin ulcers also. I hope it's clear. Okay, so how can we prevent ourselves from not having this edema? Okay, first is a person should avoid standing for a very long time. They should not stand for long. If they will stand long, what will happen? Obviously, they will have to put some pressure. It's not it. So that's why the person should avoid like this kind of standing for a longer period of time. Next is they should wear some comfortable shoes. Next is avoid tight clothing. Why? Because if they will wear tight clothing, the blood circulation also will become less. Okay, the blood circulation will hamper. So that's why the person should wear like loose or else comfortable wear and all that. Okay. Next is the person should elevate the leg. Why the person should elevate the leg? Because if the person will elevate the leg, there will be the blood circulation will be high. Okay, it will improve. So that's why the person should elevate the leg. Next is yeah, okay. Since in edema, you will find that okay in edema what will you find since there is low blood protein. Low blood protein is known as albumin. Okay, albumin. It's the name of a protein, albumin, which is that you will find in blood. Okay, albumin. So in albumin, okay. So since there is low blood protein in edema, okay, you will try to increase. You will have to try to increase the blood protein, which is known as albumin, in the patient. So for increasing the blood protein, which is known as albumin, what the person should do, the person should have rich in protein such as green leafy vegetables, right? All these are good for blood protein. Green leafy vegetables, then pumpkin, pineapple, all these are nutritious food for the blood protein. Understand? So that's why the person should have all those. Okay, next is healing tissue. Means if a person is having trauma, like if a person is means he or she came from an accident or all those, so the person should not just sit or stand still there. The person should go and seek for help. All right, the person should go to some hospital or some emergency room so that they can prevent the leakage of fluid, the leakage of blood. Understand? So that there won't occur any inflammation. So that so as a result, the person should go quick. Okay, first aid. The person should go and seek help. That is first aid soon, quickly. Okay, next is limitation of salt intake. Since there is a high sodium chloride, sodium level is increased, so the person should limit the salt intake, such as by not having chips, pickles, all this. Now, all these are rich in salt, right? So the person should have like mm, they should limit the salt. Okay, so next is diuretics. So the person should have diuretics. Okay, diuretics is the name of some medicine or drugs. So the common one is Lasix, Laxix, Lasix. So diuretics, it is mostly used. Why? It is mostly used because uh, in order to decrease the fluids which is there in the body, right? In order to decrease the fluids, excessive fluid in the body. So that's why the person should have like this kind of drug. It is diuretics because it decreases the extra amount of fluid in the body. Okay, is it clear?
Yes, ma'am.
Clear now, everyone? I hope it's clear. Everyone, Darshana and all, are you clear? Elephant, Pale, Tumpe, Jilan, Nafishisha and all, are you clear?
Yes, ma'am. Yes, ma'am.
Okay.